Thank you, Mr. Chairman. Question for Lieutenant Governor Colyer, Secretary Clyburn, and Mr. Hudson, Senator Hudson, Representative Hudson. Does Obamacare raise premiums in your state? Does Obamacare raise insurance premiums in your state? Do you know?
We have not had the full release of what it does to premiums across the board for that, and the federal government has not released that information for us.
Okay.
However, we have an example when we've gone to the website, and in all of the examples it shows a dramatic increase in cost.
Madam Secretary?
For some groups, up to 200%. Again, we don't have all the details in terms of, what it's going to mean for every different type of population, but we do have data that indicates for some groups it will go up to a 200% increase.
Representative?
Like my colleagues before me, we lack a tremendous amount of actuarial value to be able to make good discerning judgments regarding that. And as the rules have continued to change, we can project, and the projections are not good. They will go up.
Lieutenant Governor, does Obamacare reduce choices in your state?
Absolutely, it reduces choices in the scope of plans that people can choose, and also in the number of insurers that are in the exchange.
Madam Secretary, same question.
We currently believe there'll be 4 exchanges. In our Medicaid plans, we now have 5 choices for individuals who have Medicaid recipients. So in those instances, if you compare the two, it would reduce some level of choice.
Representative Hudson, do you have an answer to that same question?
Yes, it will definitely reduce choice.
What is the overall view of the citizens of your state with regard to Obamacare? Again, Lieutenant Governor.
Kansans are overwhelmingly against it. They see economic impact and how it affects their health care.
Madam Secretary.
We've had several polls as well as debates within the legislature that indicate that overwhelmingly there is not a will to move with expansion or towards some of the implementation of the Affordable Care Act.
Representative Hudson.
Floridians are absolutely opposed to it, and they recognize in our state, like many states, that the rural areas are going to be disproportionately affected. Lack of choice, lack of access, and tremendous challenges with workforce, which makes things almost impossible to implement. A one-size-fits-all doesn't work well in clothing. It doesn't work well in this either.
Thank you. Attorney General Wilson, question for you. Obamacare's implementation has problems, delays, and will lead to greater state spending, higher insurance premiums, and greater burdens on business. Can you tell us how the law is impacting the citizens of your state? How are the delays impacting the state's ability to comply with new federal requirements as well? So the question is twofold: the state's ability to comply, individuals' impacts.
Well, we qualify this by saying that independently, that is not something I'm qualified to comment on. As my opinion, my personal opinion, that it will adversely affect our citizens in our state. My one thought, Representative, is that I'm begging Congress, if they want to criticize the criticizers of Obamacare, if they want to criticize me and other folks who share my view, I welcome that. That is part of our American process. But look at the questions we're asking as consumer advocates, and look at that independent of Obamacare. And let's look out. We have a duty as elected officials to protect the citizens. And I think right now we're getting into a debate on the merits of something that's been decided instead of how to make it better going forward. And I'm begging Congress to look at the questions the AGs have asked. Thank you.
Lieutenant Governor, could you describe the regulation process and how it's impacting Kansans as citizens and the Kansas government as well?
There is some issues of transparency. Here it is 2 weeks before. We don't know what all of the rates are. We are getting new software updates. We have a new software update coming sometime before October 1st. So even if the navigators can't be trained up to date on that, we're having to work overtime to try to comply.
Considering that the President of the United States, after whom the bill is named, is the person who's done the most to delay implementation of Obamacare, Do you think it's appropriate to say that the obstruction is coming from outside the White House?
No, I wish they could block a number of other areas as well.